Hi, Allie. I'm your nurse today, and I'm going to be instructing you on how to mix two different types of insulin and also instructing you how you will inject yourself with insulin. Has your doctor talked to you about any of this yet?
Just a little bit.
Okay. Well, basically, your pancreas isn't functioning properly, and your pancreas is responsible for producing and making insulin.
Okay.
Insulin is a hormone that is responsible for controlling your blood sugar levels. So when your blood sugar levels are kind of out of control or too low or too high, it's normally in response to something going wrong with your pancreas. Unfortunately, your pancreas is not producing enough insulin, so we do need to start doing insulin injections for you.
Okay.
First of all, what you always want to do is you want to first gather all of your equipment. You want to always make sure you have one vial of clear regular insulin,
Okay.
one vial of cloudy NPH insulin, one insulin syringe that has units on it, and also your antiseptic swabs.
Okay.
You want to make sure that you wash your hands, and then you want to first look at the appearance of these. The regular insulin is always going to be clear, so if there's any discoloration, you want to make sure that you throw it away. Also, the cloudy is the NPH insulin is going to be cloudy. You want to make sure there's no clumps in it. And you are allowed to store these at room temperature. And if you buy them in bulk, you can put them in the refrigerator, and then when you need them, you can take one out at a time.
Okay.
You want to make sure you always check the expiration date on these, because after you first put the first date on, once you first use it the first time, 28 days later from that, you cannot use it anymore and you have to discard it appropriately.
Okay.
Okay? So first what you're going to do is you're going to clean off the tops of your insulins. And then you're going to make sure to mix your insulins. You're going to mix them by rolling them between your hands. You want to make sure you do not shake them,
Okay.
because this could make the appearance look frothy, and then it'd be really, really hard to pull up the measurements from with your syringe.
All right.
When you're picking your syringe, after you get your syringe, you want to make sure it always remains sterile. If it touches the outside of anything on the vial, if it touches the insulin when it's just injecting air, it will become unsterile, and you will have to end up discarding that into a container, like your laundry detergent container, anything that's convenient inside of your house.
Okay.
You don't want to be injecting an unsterile needle into you, because then you might not get the right proportion of the medication, or the wrong order will definitely affect how it's being absorbed into your body.
Okay.
So what you're going to first do, let's say that your doctor orders you 10 units of regular insulin and 30 units of NPH insulin. What you're going to first do is you're going to inject air into the vial, always first. You want to make sure that it's down on a flat surface. You want to make sure you're not touching the insulin as well. You're going to inject 30 units of air, but before you do that, you want to make sure that you pull down to 30 and make sure that it's right on the 30. The bottom line has to be on the 30.
Okay.
And you're going to inject the air into it. And you're going to immediately withdraw the needle from it, because you always want to go straight to injecting air into the regular insulin, which then you're going to pull down to 10 units of regular insulin.
All right.
You're going to inject the air again. And now this time you're actually going to withdraw 10 units first. You always want to make sure you do clear before cloudy.
Okay.
So if you have any air bubbles, you can sometimes pull more out, but always make sure that you go back down to 10, because you only want exactly what the doctor prescribed you.
Okay.
Now you're going to go straight over to your NPH insulin, and you're going to withdraw 30 units, and that would end up being 40 because you've already injected 10. You already withdrew on 10. So then you're going to have 40 units, and you can clap if there's any bubbles to get rid of them, and that is like this. You clap, you hold on to the vial always at all times, and you clap. And you can also flick as well if you have any bubbles to get rid of them. It'll definitely make the injection less painless if you don't have any bubbles.
Okay.
Now we're going to talk about choosing a site for the injection. There's multiple places that you can inject yourself with insulin, such as your back, your buttocks, your arm, your thigh, and also your abdomen. Your abdomen is the best place to pick because it's evenly distributed there.
Okay.
When you're picking your abdomen, you always want to make sure you're 2 inches away from your belly button. You always want to make sure there's no moles, scars, or tattoos anywhere where you choose. You also want to make sure you rotate the site so there's no irritation or aggravation by repeatedly injecting yourself in the same spot over and over and over again, because that would definitely start to cause a lot of pain.
Okay.
When you're injecting the needle, you want to make sure it's at a 45 to 90 degree angle, and you always want to make sure you withdraw the needle at the same angle you inserted it at.
Okay.
You do not want to aspirate the needle at all at the syringe before, which is, if you don't know what that is, you're pulling to see if there's any blood, which you don't have to do that. You're just injecting yourself with the medication. You do not want to massage the site because that will affect how it's distributed, and you also can put a little bit of pressure on the site. If it starts to bleed, that won't hurt anything. After you're done, you always want to make sure you put the safety on the syringe or also put the cap on it because you don't want to stab yourself with the needle. It's to prevent needle stick injuries. And you can dispose of them either in a local like a laundry detergent container, or you can also get a container from your local recycling center. And then after you're done, you want to make sure you put your vials back at room temperature.
Okay.
And always want to make sure you dispose of them after 28 days. Do you have any questions so far? No?
No.
Okay. Can I have you go ahead and return demonstrate to me and show me how you would do it, just to make sure? So you feel comfortable doing it for when you go home?
Okay. So what I'd first do is wash my hands before I touch anything. And then I'd make sure I check the date on my regular insulin, which is clear, and check the expiration on my MPH insulin, which is the cloudy insulin. And they're both good. So then after that, I would roll the insulins and examine both to make sure there's no clumps in the cloudy or anything abnormal, and make sure that the clear has remained clear. And from there, get my syringe out. And I would clean the tops of both of the vials. And the doctor ordered 30 units of MPH insulin. So I would inject the air into that of 30 units, withdraw that, pull back to the 10,
That's perfect.
and inject that into the clear insulin. Now pull back the insulin to the 10, and there's no bubbles or anything, so then I would put it back into the cloudy and pull back 30 units, which is really 40, because I already have 10 in there. And I could clap if I needed to. Then after that, I would pick an injection site, which would be around my stomach, would be the best place, 2 inches from my belly button, and I would inject the needle at a 45 to 90 degree angle after I had cleaned it with a swab. And then I would discard of my needle in a sharps box, or in a laundry detergent, whatever I have around the house. And then I would store these at room temperature.
Okay. What do you want to make sure you avoid on your stomach whenever you're giving yourself a shot?
I want to make sure I rotate and no tattoos, scars, moles, anything like that.
Perfect. So. That was perfect. You did great. I'm going to give you some instructions that you can look at if you ever forget the order of the steps.
Okay.
You always want to make sure you're always doing clear before cloudy. It's one of the most important things because that's the perfect order that you have to do for whenever you're injecting insulin, so you do not get the proteins into the regular insulin.
Okay.
You also want to make sure you're always remembering to store these at room temperature, not inside like extreme cold or extreme hot, because that could definitely affect how the medication will be distributed throughout your system.
Okay.
So you can call this number if you have any other questions. But other than that, do you have anything questions for me right now?
Nope.
Okay. I hope you have a great day, and always call that number if you need any help. Okay.
Okay. Thank you.
No problem.